Were you in an unusual group to be suffering more than the average? They spotted it and then you were lucky to be referred? Or do you think that's the wrong way to think about it? We should be offering something for everyone who goes through that difficult journey. What's your opinion on that?
I think that there are so many different types of cancer. There's so many different types of individual. I think for me, mine was slightly unusual in the way that I always say now, I have a phrase that I take with me always. And I used to use it before and I modify it now because of what happened to me with the cancer, my personal situation. I say that, you know, sometimes you don't happen to life, life happens to you. And in my case, boy, did it happen. You know, I had a serious RTA which caused the death of my father on the very day that I came out of theatre from my cancer operation. Literally, he died in another hospital in the county as I moved forward with my changed life. That brought a lot of issues with it mentally, as you can imagine. But there are people out there who don't have big stuff going off in their lives. They have just, if I can phrase it in this way, just the cancer to deal with. But what happens about other people who, if you have cancer, it doesn't mean nothing else is going to happen to you. You know, you could be being divorced, someone could reject you, you can lose your job, you could have money worries, you could get another illness alongside the cancer. So there's all these variables going off around the cancer. I think it's very important that anybody who's undergoing a cancer journey from a diagnosis, not necessarily immediately, because I think these things kick in as you're going through the journey and your fears escalate in various ways, or depression may escalate. You're so busy on that cancer road, going down that road, you don't even know, all you can focus on is going down that road, keep going, keep going, keep going. That these things are building up behind you, a bit like a shadow that's coming up and up and up. You don't realise until it's actually overtaken you and it's surrounding you what is like a cloud, what is happening. And sometimes, you know, we're so good at hiding these things sometimes and trying to be strong that the clinicians won't even necessarily tune into it. I'd love for every patient there to be that support network in every hospital, particularly in Leicestershire, because obviously psycho-oncology is there as a small part. I'd like to see it become a massive part of cancer treatment, because the treatments sit side by side. And I don't think you can have one without the other because of the type of physical problems that are there that then generate the mental and anxiety, emotional problems for the treatments that people are going through. You know, I've met all the cancer patients and they've spoken about their treatments, some of the head, neck ones, the brain ones, you know, the special things they have to wear on their heads and fixed in a certain place for long periods of time. It's difficult. It's not insurmountable, but I think until you're actually experiencing those treatments, those worries, no one knows how you're going to feel. And I think it's imperative that there's quite a big input there of psychological support in psycho-oncology attached to those units. You know, I'd love to see it national.
I think a lot of people would agree with you, but I have to put the contrary argument, just for a second, that psycho-oncology specialist services are often considered to be a little bit expensive in terms of personnel. Even employing a mental health nurse who can be brilliant could be a little bit expensive compared to something that was not paid for at all, somebody else doing the job. A frontline cancer clinician expected to do that as well. Is there some kind of compromise? And I know we've tried to develop certain things, for example, self-help materials, relevant resources like anxiety management resources, also the cancer stories program itself, peer support. These are things that could be less costly, but could be more widely available. Could they fill a gap themselves without requiring that classical face-to-face interaction? Or is that face-to-face thing, the support from another professional, the gold standard?
I think you can't move away from that. I think I mean, it won't be suitable for all types of patient, I guess. But I think in the main that, you know, every little helps. But I think if it's a win-win situation, I don't think I've spoken to one cancer patient on a peer support level, and I've speak to all different types of patients that has said, you know, the face-to-face support, the talking with the professional who understands mental health, emotional issues, you can't get better than that.